A ride in an ambulance can be quite expensive depending on your provider and insurance coverage.
Yeah, coping with a medical issue combined with a surprise bill, well, that could make an already stressful situation even worse.
Our WTOC Investigates team has been looking into surprise ambulance billing as well as your rights as a consumer. Haley Bolin joins us now with one woman's story.
Yeah, Mike and Dawn, Savannah mom Nikki Friedhofer thought she was doing the right thing when her son needed to be transported by ambulance between two different medical facilities. She is insured, but the bill she was left with was shocking.
That's Luca, me and my honey, last Christmas.
Nikki Friedhofer looks at photos of her son Luca. He struggles with mental illness, which can land him in the hospital sometimes.
It is absolutely horrible when he was in the middle of one of his episodes. It was scary for everybody. So it's a 911 call.
And his most recent trip came with quite the price tag.
I got a bill for over $7,000 for 2 ambulance rides that were a total of 2 miles each.
Friedhofer says the hospital called Central EMS to transfer Luca 2 miles to a mental health facility in Savannah twice in November. Her bill shows a $3,850 base rate. Her initial total for both trips was more than $7,400. Central EMS is out of network for her insurance.
I got nauseous. I got panicked. That's unacceptable. And then I just thought, maybe I'm misreading this. No, that was the bill.
Central EMS has a D- rating with the Better Business Bureau,
which means they have a number of complaints. They probably haven't responded to all the complaints. And in me looking at the complaints, most of the complaints were basically this issue, extremely high rates being charged.
And in Georgia, those rates are completely legal. Congress passed the Federal No Surprises Act. It went into effect in 2022. It covers emergency medical care but has no protections for ground ambulance billing. It also created the Ground Ambulance and Patient Billing Committee, known as the GAPB, to make recommendations to Congress, which Patricia Kelmar was a member.
We really need to find a reasonable rate. Require our insurers to pay that rate. And then maybe the patient has a copay, an understandable, reasonable copay that doesn't prevent them from calling when they need an ambulance.
Kelmar says the GAPB sent their full report to Congress last fall. At the state level, Georgia's surprise billing laws don't cover ground ambulances either. Bills have been introduced in past legislative sessions, but have not passed.
These kinds of issues make people think twice and they disincentivize care. And we don't want that. So this is an issue that we really do need to take up in the General Assembly, certainly unless and until there becomes some kind of federal protection.
We reached out to Central EMS about their billing rate. They provided us a statement in part, quote, "We understand these necessary services can create financial strain for families. Our billing support team works diligently with patients experiencing financial hardship to address concerns and explore all available options for resolution." Back at the salon where Friedhofer works, she's left frustrated and disappointed.
Make sure that if you have a transport from a hospital to a mental health facility, that you insist that they confirm your insurance before calling an ambulance.
Still, she says her son is what's important.
And I'm lucky, I'm able to persevere. I'm able to work extra and get him the help he needs. A lot of families don't have that.
Now, if you get a surprise ambulance bill, there are some things you can do. Experts we talked to say you can ask the ambulance provider for an itemized bill. You can also ask around for rates in surrounding counties. You can use that information to negotiate. And finally, if you offer an amount up front, they may be willing to accept that to prevent getting collections involved.